So, thank you so much.
Oh, you're welcome.
And my first question, Dr. Neumann, is how did you get started? How did you get to become a surgeon?
Well, I actually went to medical school to be a family doctor, and in my third year of medical school, my mother developed pancreatic cancer. And she had been to another institution, and they told her she was crazy because she had vomiting and diarrhea, and we didn't have CT scans in that time or anything. So they put her, and then they decided she had gluten intolerance. So they sent her home on a diet, and my father called me and he said, you know, this diet's going to kill your mother. So I said, well, you know, bring her to me, because I was back at school. And she came up, and the GI guy saw her, and he says, I think she needs to be explored. And I tell you quite honestly, I went into the room to see her, and I didn't even recognize my own mother. She had lost so much weight, she had ascites, and on and on. And they found out that she had pancreatic cancer. So they made a definitive diagnosis, and I knew what she had, and that was surgical, and I liked the surgeon who took care of her. And she actually got sick when I was on my surgical rotation. I got sick that she was going to die, and I went home to take care of her. I left medical school, and the chairman of surgery, who had actually operated on her, said that I didn't have to do a surgical rotation, that he thought I probably learned as much taking care of my mother as I would in a rotation. And I said, well, I kind of like surgery, and I would like to do one, so I did it in the summer. And I worked with three of the greatest surgeons. Their residents were just fabulous, best doctors I knew, and I was hooked.
And this was where?
It was in Syracuse.
Syracuse, in what year?
That would have been in 1964.
Okay.
And then I wanted to apply for surgical residency, and my applications were returned, and with little notes that they didn't accept applications from women. And even my own chairman, who had taken care of my mother, asked me why I wanted to ruin my life, and how was I going to be a surgeon if I was pregnant. And I asked him if he'd ruined his life, and he said, well, no, but, you know, he's a man, and that, you know, pregnancy was a time-limited phenomenon. And I knew a lot of men who were fatter than any pregnant woman I knew, and they seemed to manage to operate. So I made a deal with him that if I would do 6 months of medicine, 6 months of surgery, and after 6 months of medicine and 6 months of surgery, I'd done well enough in surgery, and I still didn't want to do medicine, he would let me have a place in a pyramidal program.
Wow. Wow.
So.
Oh, fantastic. And so, was there ever any doubt in your mind at that point, after the end of the 12 months, that...
Oh, no. I was determined I was going to be a surgeon, and I am determined.
Mm-hmm. That's clear. That's clear. We know that story.
Yes.
And so you spent 3, 4, 5 years there at Syracuse?
I did my 5 years of residency there, because my first year counted as my first year. Mm-hmm. And so I spent 5 years, and I actually was lucky. I finished my residency and went into practice when I was 29.
Wow.
So it was good.
And at that time, there were very few, if any, fellowships. So you just jumped in, and you were a community surgeon, or?
I actually, my very first job for I think 11 days was on the VA staff and in private practice. And after I'd done that for 11 days, the chairman, who was a new chairman, offered me a job in the department. So I stayed, and I did general surgery. I actually, for, gosh, a lot of years, I had sort of a subspecialty in portosystemic shunts.
Wow.
And was interested in renal flow and hepatorenal syndrome, et cetera. Did a decent number of shunts for massive ascites, and we published some of that back in the early days. But I always loved endocrine surgery. I had made the diagnosis of a pheochromocytoma when I was a third-year medical student on the medicine service. And the surgeon invited me to come to the operation, and then he let me touch it.
Oh, wow.
And I informed him that the next one I found I would take out myself.
And when did that happen?
It took a while, but I did.
So, oh, fantastic.
Yeah,
fantastic.
so I've always liked it.
So you were, I can't imagine, age 29, most people are 33, 34, 35 when they're going in. And so this would have been 1969 or so?
In 1970, I finished my residency,
Okay.
because I was a third-year student in '64.
Okay. And so then you spent some time, but then you, at some point in your career, weren't just at one community?
I was stayed at Syracuse my whole career. I'm a lifer.
Yeah.
I went there to medical school, and I've stayed ever since. Every time, you know, I thought I wanted to leave, I'd sort of look at it and I'd think, you know, I've got a lot going for me here, and the things that I don't have, who knows what they'll be like someplace else. And so I just stayed.